Так, там меня видно вообще где-нибудь или нет?
Я сейчас.
А, все, давай. То есть я говорю, что мы их ждем и...
Да. Так я поднимусь, вам напишу. Или позвоню. Позвоните или написать, что хочешь.
Что хочешь, что тебе удобнее. Dear colleagues who are here, good day. Glad to see you. And today we shall meet in order to discuss very serious problem of oral medicine, but I want to ask you maybe wait 5 minutes because only one person is listening for me, and let's wait for somebody else. Maybe they will attend our lecture, maybe they will join us, and we shall start to discuss very serious and very interesting problem. Здравствуйте, Александра дорогая. Гитель прислал бумажку, что у 17 человек, которые сдавали анализы из нашего института, все отрицательно. Вот. Да. Да. Ну, Татьяна Александровна, как распорядитесь, так мы всех напишем. То есть в этом смысле. У нас бывают каждый день, но если вы хотите, чтобы я узнала, когда максимальный день загрузки, я могу это выяснить. Я понимаю, то есть вам нужен тот день, когда студентов самое большое количество, да? Я поняла. Хорошо, сейчас узнаю, какое количество студентов у нас в пятницу, и вам доложу. Хорошо. Хорошо, я поняла. То есть интересует пятница. Я сейчас узнаю, сколько у нас по пятницам студентов. Но не все это точно. Сейчас я узнаю, сколько. Хорошо. Да, естественно. Да, хорошо. Это однозначно. А вы сами-то вакцинируетесь? Все понятно. Ну, странно, я что-то пропустила это дело, я тоже обычно вакцинируюсь. Ну, я провакцинируюсь приду, потому что я всегда тоже делаю. Да. Очень, и преподаватели тоже могут. Отлично, все, прекрасно. А вакцина нормальная, Татьяна Александровна? Не надо свою покупать? Все, поняла, да. Хорошо, спасибо большое. Да, сейчас сделаю. So, let's start our lecture. Dear colleagues, today we shall discuss a very important problem of dentistry and of oral medicine, precancerous disease and cancer vigilance in oral medicine. In European Pre-Congress in Amsterdam, Professor Bruce Donoff spoke about very important problem, the main direction of the development of dental education in the world, not only in his country. For many years he was the dean of Harvard Dental School, and he said that the main direction of development of dental education is the movement from dentistry to oral medicine, because it is very easy to teach somebody to make good restoration, to make good filling, to make good implant, good artificial crown, but it is very difficult to understand the connection between human organism and mucous membrane disease. And it is very difficult to diagnose and to treat diseases of oral mucous membrane. So movement from dentistry to oral medicine. What does it mean? It means that dentist must know a lot about mouth cavity and a lot about human organism in general. The main principles of movement from dentistry to oral medicine are: first, attentive and careful attitude to the patient; cancer vigilance; specific vigilance. About specific vigilance we shall speak in one on our next lecture. Awareness of the manifestations of somatic diseases in the oral cavity and side effects of medications. Awareness of age-related changes in the oral mucosa and the possibility of their correction. Then, ability to give convincing and real recommendations to our patients. And attitude to the tooth as a great value. Compliance with the principles of collegiality and constantly updating our knowledge. You see that cancer vigilance and knowing of precancer diseases is situated on the second place among these principles, because this problem is very important and very widespread all over the world. Why? Let's see the figures, the statistics. 78% of all cases of oral and lip cancer in Russia are diagnosed at the 3rd or 4th clinical stages. What does it mean? It means that from the very beginning of the disease up to the moment of diagnosis, time was lost by patient, by doctor, and treatment on the 3rd or 4th clinical stages means that patient needs operation, patient needs chemo and radiotherapy, which will make him handicapped. So, the problem of early diagnosis and predicting of cancer and precancer processes are very important problem all over the world. And such situation is not only in Russia. In America, in Europe, nearly 70% of all cases of oral and lip cancer are diagnosed at the 3rd and 4th clinical stages. Let's see. Incidence of oral cancer in Russia among men, it is 6.65 cases per 100,000 population. Among women, a little bit less, not little but less. I think it depends upon that among women there are not so many smokers and alcohol users. But in general, in Russia were registered more than 9,000 new cases of oral mucosal cancer, and the average age of such patients is only 61 years old. What does it mean? It means that all these patients can be good grandmother or grandfather. They can work, they can teach, they can treat if they're doctors. But now they are a patient and they must treat their problem, their cancer. Why? Because we have no system of early detecting of precancer lesions. Why? Because maybe we don't know exactly how it looks, how to do it. Maybe patients have no possibility to visit their dentists once a year. in order to supervise the mucous membrane and to see this lesion? Who knows? But statistics are very cruel. Nearly 70% of very late detected cancer incidence. In the clinical recommendation, cancer of the oral mucosa, edited by academician Professor Davidov, there are very interesting information about etiology of precancer lesions and cancer as well. First, bad habits, smoking, alcohol consumption, chewing various mixtures, industrial hazards, chronic infection in the oral cavity. What does it mean? It means that bad oral hygiene can stimulate development of chronic infection, which can be one of the etiological factors of oral cancer. And of course, the worst is chronic traumatization of the oral mucous membrane, sharp teeth and their roots, poorly made prosthesis. What else? Definition. What does it mean, cancer? Cancer of the oral mucous membrane is a malignant tumor that develops from elements of a multi-layer flat epithelium, which covers all mouth cavity, palate, cheeks, gum, bottom of the oral cavity, tongue, all, absolutely all anatomical formation of oral cavity. And we know very well that mucous membrane of oral cavity is very specific tissue of the human body, because we irritate it every day many times with hot or chilled food, with spicy food, with cigarettes, with alcohol, with chronic traumatization. And flat multi-layer epithelium has very high potentiality for epithelialization to close the defects which formed under the action of these irritants. Let's see. This is a lady, young lady, 44 years old. She complains about the presence of something in the palate. In anamnesis nearly 1 year ago, a fish bone stuck in the palate. There was a painful formation that was injured when eating. Very interesting thing that this lady is very careful, provides very careful oral hygiene. And 3 or 2 times a year, she visits her dentist for professional hygiene. All this period having formation in her palate, she visits her doctor 2 or 3 times. And doctor didn't pay attention to something growing on her palate. What does it mean? He was not attentive enough. He just made the procedure, cleaning, polishing, removing calculus, and no idea that it is necessary to supervise all mucous membrane. So, no principles of cancer vigilance in everyday work of this doctor. First, this formation was painful, then no pain, and this woman complains only about the fact of presence of something. Of course, we sent her immediately to our oncological cluster, and they diagnosed epithelium cancer. Can you imagine how difficult operation she needs now? This clinical situation proves that early diagnosis of precancer and cancer lesion in the mouth cavity is the key to the successful treatment without large operation, which easily can make handicaps from our patient. One more situation. This patient is old enough, 74 years old. He complains about the inability to use a removable prosthesis, despite constantly contacting with his dentist. First, he used the removable denture during eating. Then it was impossible to use it absolutely because part of his gum was enlarged. When we saw this formation in his mouth cavity, we see all the features of malignant tumor. Small islands of hyperkeratosis. It is very hard during palpation, like a cartilage, absolutely no pain, large and not movable lymphatic nodules. And when we made X-ray picture, we saw that bone is involved in the process. So, this is 4th stage of oral cancer. Who is guilty? I think the dentist, because this is the clean care of iatrogenic cancer. When we provide our patient with removable denture, it is necessary to point out many times that twice a year the patient must visit his doctor in order to correct the base of the removable denture, because constant pressure of the base of the removable denture to the mucous membrane is the reason of changing of mucous membrane. And of course, removable denture begin to move, begin to traumatize mucous membrane, and chronic traumatizing of mucous membrane can be the reason of the beginning of precancer process, then to transform of it to the malignant process. So, this is clear iatrogenic case of oral cancer. One more clinical case with iatrogenic situation, again with a removable denture without necessary changing a necessary correction of the basis. Here we can see all the features: plus tissues, hyperkeratosis, ulcer covered with the fibrous plaque, and here as well, and plus tissues in the sublingual zone. 6 years and no case of correcting of the base of this denture. So again, iatrogenic case. One more clinical situation. Please, let me see. Large removable denture on the upper jaw. You know that each tooth situated on the lower jaw will improve the fixation of the removable denture, and on the upper jaw, absolutely vice versa, opposite situation. One tooth can destroy the fixation absolutely, can make it poor. And we see such situation in the case of this patient. 6 years ago, she got the removable denture, and for 6 years, no case of correction. She came to our clinic with the complaints of the large ulcer on the palate and partly on the alveolar process of upper jaw. First it was very painful. Now it is not so painful, but palpation is unpleasant. When we saw the removable denture in the mouth cavity, it was movable. It was movable. So during moving, it was a factor of irritation, a factor of traumatization of the mucous membrane of the upper jaw. And the result of this traumatic injury is the huge ulcer. Good information that it is sensitive to the palpation. It means that we have a hope that it's not cancer. And of course, it is necessary to correct this removable denture immediately in this very appointment. It is necessary to prescribe therapy to stimulate epithelialization of such defect, and if no result in 7 or 10 days, it is necessary to send such patient directly to the oncological department. Here you can see the prostatic stomatitis. Prostatic stomatitis is very widespread situation in dentistry because sometimes doctors cannot motivate their patients to visit them once or twice a year for correcting of the basis of their prostatic denture. And chronic mechanical tremor, chronic mechanical irritation of the mucous membrane of the alveolar part of lower jaw and alveolar part of upper jaw can provide the growing of tissue, can provide hyperkeratosis, all these processes which can be precancer processes and which can transform to malignant processes. One more situation. Please see at this ulcer on the back side of the tongue, which is good. Good that it is sensitive to palpation. What is bad? Bad that we have this age. This age is hard enough and we have hyperkeratosis in the region very close to the ulcer. In such cases, it is necessary to send patient directly to the surgeon or directly to oncologist. What we can do? We can see if he has factors of chronic mechanical trauma in his mouth cavity. It means we can check sharps, we can check if the teeth are sharp, or detail of the removable denture or artificial crown, and we must remove all traumatizing factors from the mouth cavity, and of course to improve oral hygiene in order to stop irritating by microbial factor. If I will ask you, what is the reason of the formation of such ulcer? I think all of you will tell me that it is chronic mechanical traumatic injury by this single tooth. This sharp edge is the reason of chronic mechanical injury. You can see large ulcer with the small islands of hyperkeratosis and covered with a fibrous plaque. No pain during palpation. It's a signal that we must send this patient directly to the surgeon or to the oncologist in order to make biopsy and to see which kind of cells are here. It is oral cancer. Several tissues destroyed by oral cancer and affected by oral cancer. Here you see surface, back and low surface of the tongue. This formation is very hard, like a cartilage. These are two ulcers, no pain absolutely. Huge ulcer like edema in the vestibule of the mouth cavity. And of course, this patient is not crazy about oral hygiene and taking care of his teeth. He is an alcoholic and a smoker for many years. And of course, his alcoholism and smoking contribute a lot to the process of malignant transformation of lesions of his mucous membrane in the oral cavity. And one more feature which we must discuss is the presence of the different metals in the mouth cavity. When we have different metals in the mouth cavity, sometimes electric current can arise. And electric current is one more factor of irritating of the mucous membrane disease. And here we can see that elements of lesion here and there are very close to the part of the oral where different metals are situated. So first factor irritating mucous membrane, I think, was electric galvanic current between two different metals. And then smoking, alcohol consumption, bad oral hygiene, contribute to this situation. And now this is a malignant tumor with two large focuses, here and there. Why chronic traumatic injury are more dangerous than acute? When we have acute traumatic injury, it is very painful, and immediately patient will say, and will run to the dentist to remove the source of acute traumatic injury. For example, broken tooth, or broken removable denture, or something else. In the cases of chronic traumatic injury, there is no pain, but there is constant affecting of the superficial layer of mucous membrane. And the sign of such constant contact is the hyperkeratosis. We can see, for example, in the line of the occlusion of the teeth on the cheek of our patients, for example, and in the retromolar region. So, and of course, the reason of such formation of such elements is the chronic traumatic injury with the sharp edges of teeth. Maybe bad crowns, bad filling, maybe part of orthodontic devices, or even bad habits, for example. But chronic traumatic injury is more dangerous because patients live with it for many, many years, and sometimes when occasionally doctor will see it, like here, it is precancer, and it is necessary to operate it, to make biopsy in order to find bad cells and to understand what to do else with this patient. Now let's discuss the features of chronic mechanical traumatic injury in the case, it is the case of precancer processes. Third, change in color. Color will be redness, sometimes maybe even dark red. On the red base, we can see erosions or ulcers, or proliferative processes, or hyperkeratosis. Here we can see proliferative processes, the significant enlarge of the papilla, and hyperkeratosis. The reason of such changing of papilla is chronic mechanical traumatic injury. And of course, there is no complaint of spontaneous pain here, but palpation of deformation will be painful or unpleasant. So, the reason of such changes in papilla is chronic mechanical traumatic injury. But this patient lived with such occlusion for many, many years, and he has no sense of pain. And a doctor asked him, "Is it painful for you? Did you see it?" Because no complaints from the side of our patient. Now let's speak about factor of risk, and among them, of course, all diseases of the mucous membrane and red part of lips with erosion and hyperkeratosis can be the precancer condition, and we must consider them to be risk factors of malignant transformation. Then presence of factors of chronic mechanical injury. Then presence of galvanic current. Galvanic current is like traumatic injury but not mechanical, it is electrochemical traumatic injury. Consumption of irritating food, especially very spicy, very acid and very hot. And of course smoking and chewing different chewing mixtures and so on. And we must know that when our patient has such pigmented spots on the skin or on the mucous membrane, we must be very careful making X-ray picture. And if it is possible, it is better to choose X-ray projection when X-rays will never go through this spot, or it is necessary to close this spot with a special screen which will stop the penetration of the X-ray. So, it is necessary to point out that all defects of the mouth cavity, especially caused by chronic mechanical traumatic injury, can be a precancer lesion and can transform to cancer vigilance. Can transform to cancer. So, main principle of oral medicine must be cancer vigilance. What does it mean? Even if patient visited our clinic to make filling, to make restoration, to repair removable denture, we must mandatory examine oral mucosa of the tongue, of the cheek, all oral mucosa, all risk zones, regardless of the reason of our patient's visit. What does it mean? That first of all, we must ask our patient to open his mouth, put the light directly to his oral cavity, and to see all the surface of mucous membrane. Regional lymphatic nodes are the first structure which react on the precancer and cancer formation. And of course, we must make procedure of comparative palpation of regional lymphatic nodes and to compare their size, painful or painless, mobility, and all characteristic feature. And of course, it is very nice when we make comparative palpation of the bottom of the mouth, because there are salivary glands and the tongue. And of course, it is very useful to palpate, even comparative palpate, the region of parotid salivary glands. It is very nice that we can not only palpate and see, supervise the surface of mucous membrane. It is very nice when we can use hardware diagnostic methods. I will show you the most popular hardware diagnostic methods we use in Moscow, in our clinic. And of course, if we see something which we cannot diagnose exactly and correctly, it is necessary to send such patient maybe to more experienced colleague, maybe to oncologist or to surgeon, to a more high-scale specialists, and of course with feedback. You must know were you right or you did a mistake. it will be very useful for improving your own scale, your own experience. So feedback for exactly. I told you that it is very useful to use apparatus for screening cancer and precancer diagnostic. And we have such apparatus. It's called AFC, and it consists of apparatus himself and two spectacles, protective, orange, and diagnostic, yellow. This is the process of screening and supervising of mucous membrane. It is necessary to protect eyes of our patient with protective glasses, and the doctor must use diagnostic yellow glasses. And we put the light from the apparatus directly to the surface of the mucous membrane. But in order to see the difference, we mustn't see to this light without protection, without special screen, yellow color screen, like on the right part of our presentation. So, when the light from AFC apparatus illuminated as green or gray, it shows us that mucous membrane is normal. You can see it. Normal mucous membrane, green or gray. And when it is illuminated black, like dark spot, or deep purple, it can show on the precancer or even cancer process. This patient has diagnosed by biopsy epithelium carcinomas. So you see that this screening method of diagnostic is really good. It shows us the difference. In this case, we know that this is an epithelial carcinomas. But when we see such effect in the mouth cavity of the patient without diagnose, it is necessary to send him to surgeon or to oncologist to supervise him more attentive and maybe even to make biopsy. So, in order to prevent diagnosis of cancer on the fourth or third stage, we must carefully look with good lighting, with magnification glass, with digs, with microscope, with pocket flashlight, all the surface of mucous membrane. We must examine very careful all the risk zones. We must palpate of the regional lymphatic nodes, bottom of the mouth, tongue, air of the parotid salivary glands. We must use illumination with the apparatus AFS for all suspicious areas. And of course, in any cases, for each patient, we must identify sharp edges, galvanic current as traumatic factors, which can be the reason of precancer and even cancer lesions, and eliminate them. Even the patient will tell you that there is no complaint, and to live with such formation on the tongue is his habit, nothing serious. You must insist on operating him, because you can see that on this part of the formation there is a hyperkeratosis. It is bad. It will show us that formation, that transformation to the malignant site began. And in this very case, it is necessary to see this patient with a surgeon, of course to operate him with using a biopsy of the removed part of the tissues. This is very interesting clinical situation. A patient came and said that when he visited his doctor for the oral hygiene, professional oral hygiene, doctor found this formation on his palate. No pain, no complaints. Patient had no idea that something is situated on the mucous membrane of his palate. And here we can see large ulcer with zones of hyperkeratosis, with zones of very red edges, and absolutely not painful. When we touch this ulcer with finger, no pain. And this is bad, because no pain is the sign that malignant transformation start. In such cases, it is necessary to make X-ray investigation of our patient and to see what's going on with the bone. We made such investigation. And we see something not absolutely clear for us. So we sent this patient to our oncologist, and oncologist sent him to make ultrasonic investigation of the abdomen and computer tomography of the lungs, because this part seems suspicious for him. Let's wait for the result of this investigation. I want to tell you a few words and give you a special information about smoking. This is the very characteristic, this is very similar for smoking changes of the surface of the mucous membrane of the palate. Here we can see the changes of the mucous membrane as hyperkeratosis, and we can see very wide part of very wide end of small parotid glands situated on the palate. So this is Leukoplakia beta painer, very typical for smokers. And maybe you know that now all people try to stop smoking cigarettes and cigars and prefer to smoke different electronic devices and system of evaporation of tobacco like vape, for example. And this woman smokes for many years. And once she decided to stop smokes and stopped smoking cigarettes and began to smoke electronic cigarettes. And after a month and a half, she saw such changes on the surface of her tongue. Huge ulcer, first painful, then painless. She tried to treat this ulcer herself, but no result. And she came to us, and we saw what is good. That it is a little bit sensitive during palpation. What is bad? That we see this age, hard. We see hyperkeratosis. So we must think about necessity of referring this patient to our oncologist. And we did it. We sent this patient to our oncologist. They made biopsy and said that it is necessary to operate the tongue with the removing of large part of it. But this woman said no and decided to treat with so-called untraditional methods. Herbs, different kind of water, praying, and so on and so forth. And when she came back to our oncologist because this kind of medicine, I mean herbs, water and praying, didn't help her, our oncologist called us and said that now it is necessary to reject all the tongue with all lymphatic nodes situated under the lower jaw. It is a tragedy. And it shows us once more that rapid early diagnosis and very rapid beginning of the treatment is only one key to the saving of life of such patients. And of course, it is impossible even think about treating of cancer with herbs, with stones, with what else. It is stupid. One more very interesting case. This young lady had a precancer lesion of tongue and lip, and she was operated 2 times with laser surgery. It was laser ablation of the focus of hyperkeratosis, but each time the hyperkeratosis began to grow more and more. And before third operation with laser, her surgeon sent this lady to our department because he has no idea what's the reason of such changes. It is necessary to tell that this lady used such kind of prosthodontist construction. On the lower jaw it was all on 4, and there is a large metal part on which removable denture fixed, and she can chew, she can smile, and so on. There is a principle, very important principle in oral medicine. If you have something metal in the mouth cavity, and if you have elements of lesion, it is necessary to find galvanic current. So, electrochemical irritating factor. And of course, we measured such galvanic current and found that the reason of such hyperkeratosis is galvanic current moving between metal details of situated in lower jaw and in upper jaw. Before measuring galvanic current, this lady made a lot of analysis because nobody knows what's the reason of such growing of epithelium. And she was analyzed on Candida, on Epstein-Barr viruses, herpes viruses, and so on and so forth. All investigation, but useless, because the reason of such situation was galvanic current. And it is necessary to find galvanic couple, so two details which provide the most strong galvanic current. You see, it is strong enough. 324, and normal figure is nearly not more than 180. And of course, only one possibility to help her, it is necessary to find galvanic current, the galvanic couple, and to remove it. So, in order to make resume of our lecture, let's remind the main principles we discussed together today. First, we are not dentists. We are oral doctors, because if you want to install only filling, restoration, implants, you are a dentist. But mouth cavity is not a box for teeth and even implants and removable dentures. So we must see not only teeth, crowns, roots, inlays, onlays. we must see the mouth cavity as a part of human body in general. It is first. Then, we must understand that mucous membrane of the mouth cavity is absolutely unique formation of the human body because we irritate it 24 hours a day by spicy, hot, chilled food and beverage, by cigarette smoke, by alcohol, by chewing mixtures, whatever, and a lot of another bad habits. And of course, the unique tissue of our body, mucous membrane, have very high possibility to epithelialization of the defects. If to irritate one part of mucous membrane many times, for many weeks, for many months, it will be chronic mechanical traumatic injury with a changed epithelium layer, which can be the beginning of precancer and even cancer lesion. What does it mean? It means that if even patient came to your clinic in order to change feeling, to improve aesthetic and so on, we must for sure see all the places which can irritate, which can affect mucous membrane disease. Prosthesis. We must see sharp edges of teeth, sharp edges of roots. And if there is a metal details in the mouth cavity, it is very nice if you have the possibility to measure electrochemical potentials. So, let's palpate lymphatic nodes because they first show the reaction on precancer and cancer processes. And I think if we shall be very attentive towards our patient, if we shall use the screening apparatuses, in Russia AFS is very popular. I know that in Europe and in America doctors use Visilight and different colors, laboratory colors, in order to screen, in order to see the precancer lesion in the very, very beginning. But all the lesions in the mouth cavity we must estimate from the point of view that they can be precancer elements. And I know that maybe very few group of doctors among you will work with mucous membrane disease because this is very difficult part of oral medicine, and in many countries dermatologists work with it. But in any case, you must know what does the principles of cancer vigilance means. And you must supervise attentively all the mucous membrane, all the red lips, red part of lips, all the lymphatic nodules and salivary glands from the point of view of cancer vigilance. Mouth is not the box for the teeth, but mouth is an anatomical formation covered with the multi-layer flat epithelium, which can be the beginning of the precancer and cancer. So, cancer vigilance is one of the most important principles of the oral medicine. And if we shall know that all lesions in the mouth cavity we must see from the position of cancer vigilance, we shall reduce this terrible figure, 78% cancer cases diagnosed on the 4th and 3rd stages. And in this case, it is a possibility to not only to save lives of our patients, it is a possibility to improve their living in the earth, because imagine to live as a handicap without part of face, or to live with a patient from whom part of the mucous membrane was removed. It is very different things. So thank you for your attention, and you must never forget about cancer vigilance. Анечка, да ты представляешь, Мамедов параллельно с нами лекцию читал. Как такое может быть, я не понимаю. А мы что, не запланированную читали? Ага, все было видно. Так, как это сделать? А я вроде бы нажала. Так, ну вот смотри. Отлично. Так, активен.
Завтра выходной. Что же ты будешь делать?
Да, тут настраивать буду. Так, итак, что мы имеем? В чем проблема? В чем проблема? Проблема оценки симметрии. Так, фотоаппарат туда-сюда.
Это будет.